International lead, we are now hearing from a one-time healthcare industry insider sharing what led him to resign from one of the country's biggest health insurance companies. This after outrage at the industry exploded in the wake of the murder of United Healthcare CEO Brian Thompson. Wendell Potter, who worked in corporate communications at Cigna, has a new opinion piece in the New York Times on what he witnessed as a health insurance executive that made him quit. Wendell, thanks for joining us. You write about the fight for a seriously ill 17-year-old to get life-saving care. What happened that led you to leave the industry?
It was the use of something that's referred to as prior authorization. It's become something that health insurance companies are using even more frequently and aggressively than back then. 17-year-old Natalie Sarkeesian had leukemia. She needed a liver transplant. She was really quite sick. But Cigna, at the very last minute, as the surgery was about to take place, decided it wouldn't pay for the transplant. And the family raised a big stink, and it became a big PR problem for the company. And Cigna relented. But sadly, so much time passed that Natalie got sicker, and she died just a few hours after Cigna changed its mind. This happens day in and day out, and I wanted to make sure that people have an understanding that that was a case that really resonated with the media, got a lot of media attention. But every day there are people in this country who face delays and denials of care. Their lives are shortened in many cases because of this, and it's all because over the last 30 years, our insurance industry has become for profit. It wasn't that way even as recently as the mid 1990s, but now these companies are beholden to Wall Street, and as a consequence of that, they are making us pay a lot more out of our own pockets before our coverage kicks in, and they're second guessing our doctors and standing between us and our doctors. And unfortunately, so many people are not getting the care that they need.
You also write about a consumerism strategy employed by the company. Explain that.
One of the things I was expected to do was to try to persuade the media, the public, politicians, employers, that the American public needed to have more skin in the game. We needed to pay more for health care, not just through our premiums, but out of our own pockets. Consumerism was a euphemism to get people to think that Americans were clamoring for this kind of a health insurance plan that makes us pay out of our own pockets more before our coverage will become effective. It was never true, but we waged this intense propaganda and lobbying campaign to the point that today most people are in these high deductible plans. Consumerism was just a euphemism for moving millions and millions of Americans as quickly as possible into high deductible plans so that insurance companies wouldn't have to pay as many claims. We would be on the hook for more and more of our healthcare costs.
So you left Cigna, and now you've taken up advocacy for more affordable health care. What is it that policymakers and these healthcare companies, health insurance companies, need to do in your view?
Well, they need to change the way they do business. They need to be less beholden to Wall Street. Wall Street, or the financial analysts and institutional investors, are their top stakeholder. That needs to change. They need to have a refocus and focus more on the patient. They've moved far away from that. Despite the term consumerism, it was never about consumers. It was never about patients. So these companies really have to change. But more likely, they're going to be forced to change by lawmakers in Washington and the state capitals. I think employers are going to step up because employers are beginning to realize they've been taken to the cleaners. So I think it's inevitable. And the reaction that we've seen since the tragic assassination of Brian Thompson, the United Healthcare executive, the outpouring of rage, I think, is capturing the attention of policymakers and the media, certainly. But also employers. I think we will see that out of this tragic event, there may be some positive developments that force this industry to change its business practices.
Wendell Potter, thank you so much. Appreciate it.